Newborn sticking tongue out. A newborn sticking his or her tongue out is a lovely gesture, but it can also signify certain conditions or the infant's needs. The act, also known as tongue thrusting, occurs when a baby sticks his or her tongue out between the rows of teeth when swallowing or at rest. Tongue thrusting is usually a harmless behavior, although it can signal underlying difficulties in some circumstances. This post discusses the causes of a baby sticking their tongue out and when you should be concerned. Is it normal for a baby to stick his tongue out? Babies typically investigate their surroundings with their mouths. As a result, babies sticking out their tongues is mainly natural and typical. Inherited newborn reflexes are the most common cause of babies sticking out their tongues. This is referred to as the tongue thrust reflex. These reflexes are present at birth. A reflex is an automatic muscular reaction that occurs in response to stimuli. That newborn sticking tongue out as a reflex is usual in all healthy infants. There could be other causes for sticking out the tongue as well. 10 reasons why your child sticks out their tongue. That a newborn sticking tongue out is not necessarily a cause for concern because it is typically caused by baby reflexes. The tongue push reflex aids the infant in sucking and latching on to the breast. By the age of 5 to 7 months, most babies have outgrown these reflexes. Remember to consult your pediatrician if you have any worries about your infant putting out their tongue. Other than reflexes, the following are common causes for babies to thrust their tongues out. 1. Imitation. Many elders playfully pull their tongues out to play with babies. Many pieces of research have proved that babies pull their tongues out to imitate their elders and have fun. 2. Expressing their needs. The babies might pull their tongues out to convey to the mothers that they are hungry. At times, if they are full, they might put their tongues out to signal their mothers to stop feeding them. 3. Normal reflex. It might happen due to the normal sucking reflex in babies. Examples of infant reflexes that could cause a baby to stick out their tongue are the sucking reflex and gag reflex. The sucking reflex occurs when the area around the mouth is stroked. It causes the baby to move their lips and tongue in anticipation of suckling. The gag reflex happens when the back of the mouth or throat senses a solid object. It prevents the baby from gagging. It causes the tongue to stick out to expel the probable foreign body. 4. Conveying that they are not ready for solids yet. Babies tend to stick their tongues when they are being fed semi-solids by a spoon. If your baby does it, then it means they still have the gag reflex and are not yet ready for semi-solids and solids. They stop doing this once their tongues are able to push on top of the palate and able to swallow the food. 5. Mouth breathing. Mouth breathing can cause a baby to protrude their tongue out. A baby could breathe through the mouth due to a variety of reasons ranging from simple cough, cold, clogged sinuses, allergies, inflamed tonsils, or adenoids. 6. Gas. Some babies might stick their tongue out while passing gas due to the discomfort and pain caused by excessive gas. 7. Macroglossia. Macroglossia is an abnormal enlargement of the tongue. Some babies might develop a large tongue due to conditions such as Down syndrome hypothyroidism or Beckwith-Wiedemann syndrome. At times, the large tongue might be a result of tumors or due to an injury. It might be genetically inherited, too. When babies have very large tongues, they are unable to keep them within the mouth, and hence it protrudes out. 8. Micrognathia. Some babies have congenitally small jaws and chins, and they cannot contain the tongue in their small mouths. This condition is known as micrognathia. In some infants, this condition resolves on its own by growth in the size of the mouth and development of muscles by the age of 5 to 7 months. The other reasons for micrognathia are cleft palate, and babies with syndromes like Marfan's disease, trisomy 13, trisomy 18, Pierre-Robin syndrome, etc. In this, the size of the tongue is normal, but the chin is small. 9. Hypotonia. Hypotonia is a low muscle tone, which can affect several muscles of the body, including those of the tongue. In such cases, the tongue hangs out of a baby's mouth. It might happen due to various health conditions like Down syndrome, Prader-Willi, Rett syndrome, etc. 10. Masses or abnormal growth in the mouth. Any abnormal growth of tissue in the oral cavity or on the tongue might take up room in the mouth. It could lead to sticking out of the tongue. A few conditions that can be responsible for it are a tumor or an infection of a salivary gland or cysts, such as hypoglossal duct cyst. Why is my baby sticking his tongue out after feeding? Babies stick out their tongues for a variety of reasons, including no apparent purpose at all. A newborn that sticks out his or her tongue may be hungry, full, or dislike a particular dish. Babies may also stick out their tongues in order to imitate or receive a response from their parent or caregiver. Knowing a baby's habits at a certain age can help you figure out why they stick out their tongue. This article explains why babies may thrust out their tongues. It also describes when sticking out the tongue may be a sign of something to be concerned about. Why is my baby sticking his tongue out but is not hungry? Your infant may be playing with you if he is full but still sticks his tongue out. Babies like playing with their parents or primary caregivers, and because they have few motor abilities, they rely on the one they have mastered, their tongues. Take advantage of this opportunity to bond with your child. Playing fosters a strong bond between parent and child, so stick your tongue out as well. Your infant may imitate you, or they may initiate it in order for you to reciprocate. Is baby sticking his tongue a sign of reflux? Unfortunately, some babies develop acid reflux within the first year of life. This occurs when the baby's food returns to the tummy, resulting in spit up. Other symptoms include gagging, anger after eating, and sticking out the tongue after or during eating. Fortunately, infant reflux normally fades away on its own between 4 and 6 months of age, but some newborns continue to exhibit the reflex until they are 12 to 18 months old. If you are concerned about your baby's reflux, consult with his or her pediatrician. Child sticking tongue out at 3 months. Infants can get very fixated on their tongues, assuming your child keeps on standing out their tongue for 90 days, however, doesn't show different side effects. Most likely your child is simply playing. Utilize this chance to bond and play with your little one. Make faces, entertaining clamors, and attempt to see if you can get your child to duplicate you. Child sticking tongue out at a 6-month. As suggested by specialists, we begin acquainting strong food varieties with our child at a half year. However, on the off chance that you notice your child standing out their tongue during taking care of time, this could imply that your child isn't yet prepared for solids. This is a characteristic, thus astounding, nature or reflex that keeps newborn children from stifling. At the point when this occurs, accept it as a sign to attempt later, as your child isn't prepared for anything more other than milk. Child sticking tongue out at 12 months. The inner foreskin naturally travels backward between the ages of 12 months and 6 years. If the tongue tie was only mild, this could solve the problem. Your child may discover ways to work around the problem over time. If your child has class 3 or class 4 tongue tie, symptoms may be less likely to resolve. If your kid is experiencing difficulty breastfeeding, your healthcare professional may advise you to consult with a breastfeeding consultant. If it doesn't work, your youngster may need to undergo surgery. Your youngster may also require the services of a speech therapist. This professional will assess your child's speech. Speech therapy may be recommended by the specialist. Alternatively, he or she may advise surgery. Child sticking tongue out during teething. Another justification for why your half-year-old child is staying their tongue out is that your child might teeth. At the point when the tooth begins to eject from the gums, this might cause expanding and redness. Obviously, it can make uneasiness in your child. At the point when this occurs, you could see your child staying their tongue out, there's extreme slobbering, and expanded particularity. Do take note of that, albeit the main tooth doesn't emerge until a half year. A few infants begin getting teeth at 2 months, and this is totally ordinary. In the event that you feel that there's a requirement for concern, make it a point to your kid's pediatrician so you can get legitimate exhortation on the most proficient method to give solace to your kid. Child sticking tongue out at 9 months. Newborn child tongue push reflex typically disappears on its own between 4 to a half year. In the event that your child is as yet showing the reflex at 9 months and onwards, it might have turned into your child's propensity. Your child thinks it is amusing to do and is no reason for central issue more often than not. Down syndrome as a possible reasons why your baby is sticking out his tongue. We likewise need to recognize the way that infant tongue push reflex can be a side effect of Down syndrome. The following are a portion of the side effects related with Down syndrome and why they make children stick out their tongues. Kindly note that not all children with Down disorder will show or have every one of the side effects referenced here, and of certain infants might have different side effects not on the rundown underneath. Consequently, it ought not be utilized for finding or treatment. Little mouth. Some children with Down syndrome have little oral mouths/holes, more modest upper jaws, and apparently excessively little for their tongues. Along these lines, they make it happen. Unfortunate muscle tone. Another impact of the condition is unfortunate muscle tone or hypotonia. This implies that these children can't suck actually and have their mouths open more often than not. The tongue might stand out because of unfortunate muscle control. Mouth breathing. Another side effect of Down syndrome is mouth relaxing. This is still because of hypotonia or poor outer muscle control, which makes sense of why they normally have their mouths open and tongues standing out. Albeit Down syndrome can be distinguished preceding birth or not long after birth. In the event that your child is undiscovered, however you think your child has these side effects, it is ideal to carry your kid to a specialist or an expert immediately for legitimate clinical perception and mediation if vital. Different reasons why your baby sticks out his tongue. Enormous tongue. If your child stands out their tongue more than expected and you think the tongue looks greater for its mouth, you might need to have your child assessed for macroglossia. Here the child has a bigger than normal measured tongue, brought about by issues in the veins or muscle improvement issues. When to see a doctor. While tongue reflex or tongue extrusion is a perfectly normal and natural reflex that helps the baby protect themselves in order to survive, it is best to bring your baby to his or her pediatrician for proper evaluation if it persists well beyond infancy or is accompanied by other symptoms like the ones mentioned above. It is critical that you seek adequate medical guidance so that you can begin required interventions, therapies, and treatments to assist avoid further complications. Remember that a chronic and habitual tongue reflex in babies can cause problems with speech development as well as tooth alignment. Finally, babies sticking out their tongues a lot is natural developmentally. It is a natural and instinctive reflex. Conclusion. There are numerous reasons why your infant could put his tongue out, some of which are harmless and entertaining, while others are far less so. Whatever the case may be, if you have any concerns or notice your infant struggling, contact your pediatrician and express your concerns. When you notice your kid sticking his tongue out, take track of when it occurs, how frequently it occurs, and any other unusual behavior. You can even use your phone to capture a video and show it to your doctor. Any potential swelling inside the mouth cavity, excessive drooling, micronathia, macroglossia, low muscle tone, and any trouble breathing or eating are some of the most alarming symptoms to look out for. If you like this video, make sure to give it a thumbs up, and also subscribe to my channel for more informative videos like this one.